I just want to make sure that as we have these kind of conversations on COVID throughout the campaign, that we're highlighting communities that maybe don't often get the attention that other communities get. And this is obviously a very vulnerable population, folks who've been experiencing a public health crisis for a long time, as that is what addiction is. And now that everybody in the whole world is experiencing a public health crisis, now it's a multiple layered public health crisis for folks in recovery. So what sort of tips do you have if somebody's watching this and they are in recovery or they have a family member who's in recovery? What sort of tips do you have for folks to continue to maintain their sobriety and to stay clean during this time and to stay supported?
Yeah, well, the first tip I have is go to OregonRecoverynetwork.org, which is a website that Oregon Recovers launched last Monday when the governor declared the stay-at-home order. We recognize that there's different programs of recovery, but they aren't managed by teams and staff and things like that. They're all volunteer driven. And then there's no one central source. So all of a sudden, all the recovery meetings sort of had to shut down, right? Or the outpatient meetings or the one-on-one counseling sessions. Many moved to online, but a lot didn't. And it really required a degree of initiative of individuals in those meetings. So we created a one-stop shop, hopefully, but so go to OregonRecoveryNetwork.org, and in there you can find out different types of programs, different types of meetings are online, but there's also a staying healthy tab, and that has some guidelines for both self-care. If you're a person in recovery, if you're locked down in your home, it doesn't mean exercise, it doesn't mean you can't meditate, you need to eat right, and then it has tips there for family members too, and friends and family members of, if you know somebody in recovery, reach out to them. Even if they're 12 years, 20 years like me, this is a hard time for us.
Right.
12 years in recovery, I still attended 2 AA meetings each week. And I did it partly because there were newcomers there who needed to see that you can recover. Also because it helps me strengthen my recovery, and not having that system that I have come to rely on in 12 years. And that fellowship, other people in recovery, we sit shoulder to shoulder, we hug, we hold hands, we pray together, whatever the case may be. That network of other people in recovery who've been down the road I've been on, or the road that your mom's been on, or your brother's been on, that's really powerful. And that's, not only was it taken away, it was literally taken away overnight, right? And so, reach out to people that you know are in recovery. If somebody